if your social worker is doing this and has 3 admissions and 5 discharges the same day, like, how do I fit in? Because my ultimate goal wasn't just to get referrals, but like, how do I get senior director to one day say, how do we make this gentleman and his colleagues in this company part of our everyday conversation and process?
Welcome back to the Home Care Strategy Lab. A little love from me, your host, Miriam Allred. Before we get into it, I just want to say thank you again for tuning in. I'm glad you're listening, but I also hope that you're learning and doing. This information is good, but it only is best when it's applied in your businesses. So I hope you're taking what you're hearing week after week and turning it into tactics and adaptations for your business. Today, I'm super excited to be doing something that I've been wanting to do for a while, and I have really high hopes, so I have a feeling that we're going to start doing more of this. But today, I'm joined by 2 people. I've got Wayne Morgan, presently the co-owner and COO of Amada of Central New Jersey, formerly on my past podcast, so that some of you may know him, but he was formerly a case manager, served in business development representative roles, and was also a VP of corporate development, so has a really vast background. Then I'm also joined by a special guest. I have Brianne Muchmore, currently the Regional Director of Referral Operations at a nationally recognized skilled nursing facility group. She was formerly the Senior Director of Care Management at Spalding Rehabilitation Hospital, one of the most prestigious high-end rehab hospitals in the area, Boston region, but also probably in the nation. So Brianne is a special guest. I haven't had someone like her, let alone her, on the show before. So I'm super excited to have this conversation about both of you working together kind of in a past life and a past role. And we're going to dig into that relationship and that experience. And Wayne, how you got your foot in the door and how you started winning referrals from Brianne at that prestigious rehab hospital. So thank you so much, both of you, for being here.
Thank
Thank
you.
you. Appreciate it.
I just kind of quickly overviewed your backgrounds, but I want you to share a little bit more depth, paint a little bit of color into your backgrounds, your work experience, and then also share a little bit more detail on your point of view that you're bringing to this conversation. So, Wayne, let's start with you, and then Brianne, over to you.
Yeah, no, I appreciate it. And thanks for the opportunity. Thanks, Brian, for being a guest and joining me. And thanks to the listeners, right? This is what it's about. So, like you said, I am the co-owner of Amada Senior Care of Central New Jersey, CEO as well. You know, titles are titles, but we've been in business for this will be our second full year. So about a little over 2 years. We're doing extremely well. We're within 2 full years. We're looking at most likely trending right now $2.5 million. So really excited. We're growing a great team. We're helping great clients, helping really good families, hiring amazing caregivers, which is the most important thing. But to backtrack, I grew up in a restaurant setting, hospitality background. As you mentioned, I was a case manager working for a care management organization, helping adolescents that were at risk. My caseload at that time were children that were detained in detention centers. And my job actually was working for the judge of Bergen County, New Jersey, to actually reduce the length of stay for children in detention and to work with the stakeholders, the attorneys, find the resources for them to rehabilitate them, which in a weird way, I did correlate now with senior care. And then from that time, just building, a little bit of my resume, my experience, working with families, working with kids, strategically trying to figure out how to help them. I was then presented an amazing opportunity to be part of another home care agency in New Jersey called Homewell Care Services in New Jersey. At that time in 2017, they were expanding, and the owner needed another business development representative to expand into a new territory. And I was grateful to be part of that team. We expanded. We did really good. I was with them, I'd say 5-6 years. If anyone's listening, home care years are like dog years, but really good dog years. You work hard, you learn a lot. That team there taught me everything I knew. I was very spoiled. I was put in front of a lot of mentors that you've had, currently on your previous shows with consultants and coaches. And, that leadership from that company gave me every tool to be successful. And lucky enough, my field nurse became the nursing director and a COO, and now currently the CEO. So I learned from really good people, but they also gave me the tools. But I also, I studied. From there, I wanted to kind of like go more in like not just consulting, but like more of a national role, just because working within Homewell, we had a lot of other Homewell owners reach out, a lot of other, marketers, salespeople. I don't like the word sales, but business development representatives like come to us and shadow me. And that was like one of my favorite things to do. So I was actually presented an amazing opportunity to do corporate development for another home care agency who is in 6 states, 20 plus locations, called Caring People. Amazing company. The owner, his grandma started the company in New York. Really great teams. It gave me an opportunity to go into other states, other markets, and learn, but ultimately streamline processes, help with sales training, actually utilize a lot of operational experience that I knew I had, but I actually didn't realize I knew so much. Um, but that's why I was successful in that business development role, was understanding operations and procedures and systems. I was with that company for a little over a year. We did very well. Part of that job was to actually expand into Boston. So within 1 year, we developed that team and developed that office where we did just about $1 million in 1 year. From there, I really thought about consulting and kind of doing my own thing. And thankfully, I had a really good relationship with the owner of Amada Senior Care in Bergen, Passaic County, New Jersey, where we decided to be co-owners and join forces. And Amada Senior Care is a fantastic franchise nationally as well, and I have good back end support. And here we are.
I love it. Thank you so much for sharing that, Wayne. We were talking before this. I like to have you dial through your career history because there are administrators and directors and GMs maybe listening to this podcast, and you almost don't know what you don't know about like a career path in home care. It's a little bit ambiguous. And so I like to hear like your progression because, again, I think even that's useful for people to understand like different pivots and roles are possible inside of home care. So excited to hear more from you today. Brianne, why don't you jump in and talk a little bit about your background and your point of view?
Absolutely. Well, first of all, thank you guys for having me. This is so exciting and really a great opportunity to be a part of this. So, my name's Brianne Muchmore. I am a clinical social worker by background and a certified case manager. I received my bachelor's degree at Baylor University in Texas and have my master's degree in social work from Boston College. So, my career, I knew from truly probably at the age of 5 that I wanted to go into the field of social work. Just wasn't sure exactly what social work was at that point, but I knew I wanted to help people and I knew I wanted to make a difference. And my career path has really led me to the place that I'm at today. So I started working in Boston after graduating from Baylor, and I spent a lot of time in the city of Boston working with patients with mental health disorders, helping them with jobs, finding jobs, obtaining employment, doing some job coaching. And it was a really great entry to the career and the profession that I'm in currently. Then I transitioned to working into inpatient psychiatric hospital as a clinical social worker, which really laid the foundation for all of the work that I've done throughout my career as a clinician and also as a leader and administrator. And more recently, I was the Senior Director of Care Management for Spalding Rehabilitation Hospital. Spalding is an amazing hospital, model systems, and they are currently number 2 hospital in the nation, which is really exciting. I oversaw a team of about 60 clinicians, including social workers, care managers, inpatient teams, outpatient teams, utilization management, and some very unique donor-funded programs as well. So after almost 12 years at Spalding, I made the decision to transition my career to the another side of the post-acute world. And so I'm currently working for a large skilled nursing facility company that's nationally recognized. And I'm a regional director of referral operations, where I have the opportunity to really build relationships and work with our hospital partners and hospital leaders on the throughput from the hospitals and getting them into our skilled nursing facilities here in the state of Massachusetts. So, a little bit about my career. In addition, I am super passionate about the field of social work and case management. I've been fortunate to be elected to the board of American Case Management Association, the Massachusetts chapter, and recently president-elect for that organization. So that's a little bit about my background, and excited to share more about how I've interacted with the home care agencies, particularly Wayne, and how we can continue to do great work together as hospital and community partners.
Fantastic, Brianne. We are lucky to have you. Honestly, this is my honor to interview someone like you. And I know you're nervous, but that just made me nervous. Like you're the real deal. But that's why we wanted to have this conversation is you see home care from your angle, and that's what we want to talk about today. So just kind of a quick overview of how this conversation is going to run. In home care, we talk a lot about the low-hanging fruit, the referrals that are pretty easy to go out and capture, and next week you're getting that first referral and you're already moving. This is the opposite spectrum. This is the long-term relationships that are hard to get in a market, that take weeks, months, even years to build a relationship like this, to get that first referral, because you said it yourself, Spalding is number 2 in the nation. So we'll talk about this, but home care agencies are walking in left and right, and you're turning away, I don't know, 98% of them and only working with a handful. So what we're going to talk about is Wayne getting your foot in the door with
Mhm.
Spalding, with Brianne. Then we're going to talk in depth about the discovery phase, like building that relationship, building that trust, getting that first referral, like all of the legwork that goes into that. And then we're going to talk about like getting creative together, building up programs and initiatives and value adds to support each other. And then we're going to talk about the continuum. Brianne, obviously, you have all of these other partners, and Wayne needed to tap into those. So we're going to talk about like building the continuum around each other to make you essential and irreplaceable, and to drive really that long-term growth. So we're also going to talk a lot of stories, a lot of mistakes, a lot of lessons learned. Like I want you guys to sprinkle all of that into this conversation. So Wayne, let's start with you and let's go back to kind of the beginning. How did you first come across Spalding? And then how did you
Sure.
find Brianne at the organization? And what was your initial approach? Like literally like that first meeting or the first couple of meetings, like what was your approach to meeting her?
Sure. Where do I start? So when I joined the previous home care agency, and we were building up really good systems in place on a national scale. And that was one of the things I was always taught is like you have to follow these specific processes, and we have to make sure our operations are set up for success. And the business development team, you know, you're not just going out and bringing coffees and saying what's on your brochure. And it's about like being passionate about the work, but also like, you got to walk the walk too. And um, when I was given the opportunity to build up a team and an office and put not just the brand out there, but also hire really good caregivers and give them opportunities to work, it was exciting. So let's just go back to like the initial discovery phase. And anyone who's ever listened to our previous podcast, like I'm a big research data guy. I didn't really know much about Boston. I really just went to Boston to visit friends and find reasons to eat at the North End and just do my own thing. But really it was, where do we go, right? Because Boston city proper has a lot of work opportunity, but also outside the actual city itself, there's, a lot of those, let's say, low hanging fruit referral sources. And it's a big territory. So where I'm going with this, I did so much research, like who are the key players, which hospitals are in the city, if they had any, referrals to subacute rehabs or assisted livings or geriatric care managers, or obviously every discharge is probably going to a home health company or a hospice company, like who's who, because it was a lot, and it was new for me, but we were a startup essentially. There was one office, maybe like 5 clients, a few caregivers. So it was start from scratch, which it's like so excited for. So anyway, Spalding came up, and in New Jersey, I had a really good rapport and experience with referral sources that were very similar to Spalding. And for me, I'm not a nurse or a clinician, but like I love the clinical aspect of our job. Maybe it's because I was groomed by nurses at my at my other home care agency, but like that just drew me in. And I always felt like if where can I go, or what's the most challenging place, but also like what can I learn, right? So I was that business development rep that went to like directors of therapy and would ask them what their progress notes meant. And they would look at me like sideways. And I'm like, I need to know why you're referring 12 hours of care. And I know you should be talking to my nurse because clinical is a clinical. You'll both get it. But I'm kind of like, what are all these acronyms? So anyway, I knew Spalding was like a really, let's just say it, like it would be difficult to get business there. But I also looked at it as like this would be a great opportunity if I could somehow become part of their process, help their patients, but also like, in a way, utilize as business development. Like if they needed a step down subacute, if they needed senior living, if I could partner up with the power partners in the community and help them too. Like, what do I do? So let's fast forward. Like Brian says, she's part of the American Case Management Association. We held a table there at a conference. It was about November of 2022. And, you're giving out chowskis and flyers and your speakers there. And what's great about those conferences on nationally scale is they have great speakers about education and industry trends and maybe what local hospitals are doing within the Boston market in terms of bettering their systems, bettering the experience of their patients, to what resources are out there if you run into X, Y, and Z challenges. So I sat in those sessions, which always blew my mind. There was not really many home cares there. And, at the end of the day, I was business development. So my head's on a swivel. I'm saying, okay, who's there? Who could be good for business? And maybe one of the places on my list is there, right? So Brienne Spalding is there, and lo and behold, I had like a couple fun games on my table, a raffle, and I guess she's into games. So um, secretly, I knew who she was, full disclosure, but I pretended I didn't. And, we're just talking. And, at that time, we were building up specialized programs that were really focused on, preventing falls and reducing hospital readmissions and social engagement. We're really building something up different. And so, anyway, it led to really talking about our specialized programs, talking about, our data, our KPIs, and what we do well, to recruiting, to retention, to the specific type of client or patients that we can service really well. Staying within a lane and not, what I always say in previous conversations, like we weren't taking a shotgun approach with this. Like we need to really specialize in something and stick to it. And, I guess whatever I said at the time, kind of clicked. We exchanged cards. I sent a few emails. Obviously, she was very busy. I didn't expect her to jump to an email and answer me right away.
And
So
you
I kind of,
respond?
yeah. So I kind of just thought like, that was that. But at the end of the day, it was like, how do I book a meeting from a meeting? And my first meeting was that conference. So just again, fast forward. We had at that time, I did have like another director of business development who accompanied me to one of the campuses, and we had a one-to-one meeting, and we shared more of what we spoke about the conference. But then I really dove into like discovery questions. I always say when you first go into a referral source, you meet someone like awkwardly, it's like kind of dating somebody. Um, if you just go in and just dump a ton of information, it's like a turn off, right? So
Let's pause here though. Don't get into the discovery questions just yet. I want to plug here because I want to get into that in a second. But Brianne, I want to give you a chance to kind of like rebuttal and talk about ACMA. I think you said it, Wayne. Not a lot of home care companies are participating in this association, let alone at these events. I think that's a differentiator and an opportunity for the home care owners, operators listening to this, brand. You're heavily involved. Can you share a little bit more about what that was? And then also that initial like table meeting, like from your perspective, what were your thoughts? How did you feel like Wayne handled himself in that moment?
Well, first of all, I want to know why I didn't win the raffle prize, Wayne. It would have been fun to walk away with the prize. No, I think that our meeting was great. It stood out. There's a lot. ACMA has conferences. They have national conferences, and then they have local state conferences. But often there are 50 at state conference, 50 to 100 different community partners or exhibitors, vendors, whichever name we want to use. I like to use community partners, but we have community partners that are there, and it can be a little overwhelming because you're walking around and people are saying, you're meeting so many different people. You're meeting home care agencies, you're meeting skilled nursing facility groups, DME suppliers, and trying to figure out what stood out. And I think that our conversation with Wayne stood out because I could feel and sense his passion. I am an incredibly passionate person in like everything I do, for better or for worse. I am very passionate. And so feeling his passion and his interest in ACMA and showing ACMA as a professional organization for case managers, and majority of the case managers, or many of them, are hospital case managers, leaders, directors. And the fact that he was taking it's a Saturday, typically spending his Saturday, spending the time there, investing in the organization, was the first thing that stood out. But then also that he really seemed to understand what the role of case management in hospitals was. It wasn't like, "Hey, I have a brochure, like, let me tell you what we can do." It was like, "Wow, like, you guys really care for really challenging patients. You really take care of, like, patients that are, suffering, catastrophic injuries, are incredibly sick," and really took the time to note that patient population. And then I think, again, this is building beyond the table, but that he noticed, um the work that we did and how hard it was, and recognized the work of my team, and kind of spoke like hospital language, case management lingo about, throughput and readmissions and length of stay, all those buzzwords that are so important for us to hear. And quite frankly, many organizations, business development, leaders, like, don't focus on that. They focus on what their company can sell. And so I think that's what really, really stood out. Um, I'll pause there, and I have so much to say, but, we'll
That
pause
was
there.
perfect. That was perfect, and that speaks to what Wayne did well. And Wayne, you said it before, you did your homework, you do the research, you put in the work. So when you're at that table, you're using the jargon that Brienne and team uses, and that was like a connection point. Because Brienne, you could say the same about a lot of other home care companies that likely have approached you over the years that weren't speaking that language, that aren't using those buzzwords. And those people are quick to write off because they don't necessarily know what you all do. And Spalding is even like another layer deeper with the severity of the cases. Can you share, just so people understand, like who Spalding is dealing with? It's not even just kind of typical.
Yeah, yeah, absolutely. So Spalding has several different levels of care: skilled nursing, LTAC, long-term acute care, and inpatient rehab, IRF. But majority of the patients are coming after, as I said, a catastrophic injury. So an accident that resulted in a traumatic brain injury, an accident that may have resulted in a spinal cord injury, meaning that that patient may be paralyzed. And majority of our patients are learning to do all those things that we take for granted on a daily basis, learning to do those things again. So it is a very special population that we work with. And, not to mention, in addition, our LTAC was able to manage patients on ventilators, tracheostomies, status post transplant. So very sick patients that really needed that care. And I felt so protective of the patient population that Spalding has, and wanted to ensure that, any partner that we refer our patients to, that we can really trust them and know that they will be care for the patients like we care for them at Spalding.
Yes, 100%. A minute ago, we were joking, like, did Brienne respond to Wayne's email? I actually want to dig into that because, again, anybody's email is just like chaos. And are people responding to email or not? So, Wayne, after that table meeting, did you send her an email, or what were your like literal touch points to then get to that one-on-one meeting? Text, email, what was it?
So no texting. I was not there yet. I think I sent just like maybe 2 or 3 emails. One of the things I do, it's a little salesy. I hate the word, but it is. In the subject bar, I actually put like who I was, like, because you always get like an email like, "Oh, pleasure speaking to you," or "appointment request," and it's like, how many does she get, right? How many spams, newsletters, plus 3 campuses, 60 plus staff members. Like, you just heard the type of patients she was managing on a day-to-day basis. So it's like, all right, well, I know like I can just show up. So I think I even tried to show up twice to the front door. And it's like, there's a gatekeeper, and, you build a relationship with them. But again, you hear I like any place, they're protecting their patients. But most importantly, there's 3 campuses. So like, I probably went to one a day and tried to catch her, right? Um, no, but seriously, I put like, great conversation at the ACMA conference, like in the subject bar. It was very specific. And it took a couple attempts, and it took a couple drop bys, like physically. And then from there, we scheduled like a formal one-to-one meeting in her office now from that time, once speaking with her and understanding more of the Boston actual market, we brought in a team of registered nurses to oversee the home health aides. Then I needed a director of business development once I realized like you could spend a full week in just like north of the city. So it was a big territory. So we started like building out the operation, but I also knew I needed the actual like main director of nursing like on board, because just with the regulations and like the criteria with doing home care in that specific city, I knew we needed to approach this at a more first, like a clinical approach, right? So there's some states where you don't need like certain clinical requirements for home care. I said, no matter what referral we receive, we need to be like clinically first. And we need to see this through the scope of our nursing team. So if my nurse had hesitations or concerns or questions, like that's priority first. Like we're not doing anything until the nurse says so. Again, that just goes back to my training. I need a nurse's approval for everything. But
That's
again, it
good
was,
context though,
yeah,
because with someone like Spalding, with someone like Brienne, you only have one shot. If you blow it with a referral, with that first referral, like you're done. So I like what you're saying though, is you knew the level of expertise, the level of care that Spalding was going to require of you. So you said, while I'm trying to get my foot in the door and build that relationship, we're also going to build out our clinical function so that when we get that first referral, we are going to nail it because we
or,
have the
yep,
people in
perfect.
place and the operations in place to be able to take on a patient that Spalding could refer. So I
Correct.
like that context because, again, of course, you want a referral from Spalding, but had you gotten one and not been prepared, would have been game over right then and there.
Yeah, and honestly, the time works in favor, right? Like, as much as you want to build a business up, like time's actually the best thing you could have with our business, and I'll get more into that later in the episode. But again, it led to a formal, and then it led to in services with our team, right? I did get to know them. There's 60 plus of them, so you know that takes time. Um, I mean, it was like a solid 6 to 8 week timeline. Most hospitals and referral sources such as hers or Spalding, like sometimes can take you a year. Like nationally and statistically, it's probably 8 to 12 months. A traditional referral source, 8 to 12 consistent weeks. That's no guarantee. Like, like we said prior, like me knowing like the lingo and the language, like it wasn't me just like throwing it out there. Like I had so much experience, but like it takes so much homework and so much studying and so much to like actually comprehend all this. So like me probably asking the questions to previous referral sources, me going to DONs and social workers and actually like sitting down with them saying like, can you please explain me this progress note, or previous nurses or my current director of nursing, like, can you walk me through this care plan or why you're hesitant on this? Like that made me just get a better understanding of not just the clinical scope, but like the importance of why we might be recommending specific hours, or why their team might, have hesitations with just, PT, OT, and speech in the home, and why they're referring private duty home care. Um, so it took a lot of meetings, a lot of education to myself, a lot of education to her and her team, consistency. And then on the back end, I was building up the operation because I was involved with the operations as well. So I had to relay all the information that I was getting from their team back to my operational team, to a point, then introducing them to her team. So everybody's on the same page. So it was almost like a 2 month long project of a Spalding project and then everything else. Because like you said, if we got a referral, we had to execute it. We had to do it right, because those type of referrals were very unique, and you had to essentially have your own, in a way, like program within your program just for those patients, which we were really passionate about. Like I had a whiteboard that literally just said Spalding with like 1,000 notes. And how do we work our way through the maze of that?
So, Brienne, I want to hear about these early meetings, this discovery phase from your point of view. Like that first meeting that you had. I don't know if you can think back to like literally how that meeting went. Were you, Brienne, doing most of the talking and Wayne was doing a lot of the listening, or was Wayne doing more of the talking and you were doing the listening? Like, what was kind of the back and forth in that initial meeting, and what worked well, and maybe where's room for improvement in that first meeting?
Yeah, absolutely. I think that exactly what you said is key, because when I reflect, he was doing most of the listening and I was doing most of the talking. What woman doesn't like to talk? But no, beside that, I think that it showed that he was really invested in like the type of patients that we had and that we were caring for, as opposed to like what he was selling or what product he could offer. And going back to the email, because I'm not gonna lie, I feel a little guilty that I didn't respond to two or maybe three of your emails. But it's so interesting, and technology and social media is such a great tool. But as a director of care management, it can be very overwhelming because there are so many emails and LinkedIn messages and business cards and brochures at the front desk. And sometimes they sneak past the front desk and they're at your office. And there's so much pressure in the hospital, especially in this day and age with the way our healthcare system is operating. And so it can be overwhelming. And I know, in my 12 years at Spalding, the first year, like I never missed an email. I never respond, I would always respond. Then I learned that like I wasn't going to be able to be effective at my job as the director of case management if I was consistently meeting with different home care agencies and partners. So they really had to stand out and like make an impact for us to be able to um, give the time and to be able to have them come in. And I know it's hard for me to say that because I'm such a person of relationship building and networking, and I love that, and that is so key. But looking at the lens as a case management director and understanding the pressures that they're under and that they're guiding their teams with, it makes sense as to why we can't always give that time. So
So the million
um,
dollar question is
yeah.
though, what stands out to you? The coffees and the lunches are nice, but of all of those people that have reached out to you over all of those years, like what is the subject line that they use, or what is it that they do that really like makes your ears perk up and makes you say like, okay, I'll give you a one-on-one meeting. Like what did they do to get that, to deserve that?
Yeah. I know. I could probably summarize it in like maybe 3 points. Let's see if I can do it in 3. But I think the first would be just the as I mentioned before, like passion and like that relationship and that connection for like the work that they do. You can tell people who are just selling a product versus someone who really believes in the product that they're selling, using sales terms. But that passion and that initial like relationship. The second piece is, yes, aside from the coffee, is that most hospitals truthfully aren't even allowed to accept. So then it kind of gets this awkward thing. It was that the personal connections and really understanding, oh, hey, I saw Spalding on the news the other day, and they were ranked number 2 in US News World Report. Like those things like that really stand out of like, wow, they're paying attention to Spalding, not just talking about their agency or their organization. I think attention to personal detail is always so key to know that people are listening. Like mentioning something about like, oh, how was the weekend with your kids? I know your daughter had a birthday. Like those little things that go and say like, wow, they were really listening to what I was saying. It wasn't just coming in to do a sales call. All right, so those are my 2 points, and I think my third is um, really treating it as a relationship and being transparent about what you can and can't do. One of our most challenging populations at Spalding in a variety of discharge planning perspectives were patients with spinal cord injury. Where Spalding's a model system for patients with spinal cord injury, and home care agencies, skilled nursing, there's groups that are not trained or equipped and do not have the resources to provide care for those patients. And I want to hear that up front. And I want to hear that transparency of like, no, we actually haven't worked with a patient who has a spinal cord injury, but we're willing to learn, or like being transparent and honest and open rather than saying, oh yeah, we do that. We do that. Because I'm like, really, it's a unique area. So those are my 3 probably big points of why I was interested in pursuing the relationships. I really thought that they would not only be able to care for our traditional ortho patients, or patients that, recently had a minor stroke. Like our patients were so much more complex, and wanting to know that they could do that. Because quite frankly, anyone can care for a straightforward ortho patient. And there's a lot more to that.
I think that last point is key because in home care, we want to say yes to everything. We want to be able to staff everything and excel at everything.
Yeah,
But you're right. Be honest and upfront and transparent in what you are equipped to handle well and what you're not able to handle well, and being honest and upfront. And I think some people may see that as a weakness, like, oh, they're not going to work with me because I can't take on, maybe 25% of their clients. But you respect that. You want that
absolutely.
honesty and that trust upfront.
Yes. And I think any case manager, any case management leader would say that they're more okay with hearing no right away than waiting days and days and kind of putting all those eggs in that basket and not being able to get that outcome, or not being able, more importantly, not being able to provide the care that that patient needs. So
Yes.
sometimes
Yeah.
it's okay to say no.
Yes, I agree. I think that's an important lesson that everyone has to learn, maybe the hard way at some point or another. Before we talk about like the in services and like bringing the team in and like starting the more collaboration, Wayne, you shared with me a list of I think like 8 or 10 questions that you knew some of going into your relationship with Brienne, but also Brienne probably influenced some of those questions. These questions that you put together are like so key that every home care company that is going to attempt to approach someone like Spalding needs to know. So can you just walk through what those questions are and then
Yeah.
at the end share like why those are so important to understand to win business like this?
Yeah, absolutely. So again, like, let's just go to the dating metaphor, right? Like, you're going in, you don't know this person, you know this building, you don't know this referral source. As much research as you really do, you don't know. You don't know what happens on a day to day between those walls. You really don't, right? So, to get into it, like, I'm kind of like an old school home care guy. You have 3 campuses, right? Like, one, what does that even mean? What's the distance between them? What determines campus A to campus B? Is it just bed capacity? So with that said, like, what is your bed capacity with this campus or total? On a like estimate, like how many discharges are you seeing that are going home or, going to another home type setting to, if you have 3 campuses, like how many admissions is that? And for me, like when I started really diving into like my direct little like personal niche, like what are those admissions, right? Like there's so many moving parts with like insurances now and ACOs and patients under bundle payments and managed care and traditional Medicare. But at the end of the day, it's like, are those all traditional Medicare, admissions? Are they managed care where a length of stay is determined by the diagnosis or the skill of the patient, where you have a case manager of the insurance calling you, basically determining next steps in a discharge plan before you even see the patient? Are they part of an ACO? So that way, like, can we update that group and understand what that looks like? Like there's so many ins and outs of like the admission process alone. So for me though, I knew like if let's just say hypothetically 95% of all admissions were managed care, and and then I would transition and say, what's your average length of stay goals, right? Like, what are your outcome goals? Like, these are a little more higher clinical complex patients, but like, you have goals, right? Like, insurance can only pay for so long. So, like, what does that look like? Is it, every managed care patient was a 10 to 14-day window? Okay, so if I got a referral who was managed care, because when I did, I would say, well, is it traditional? I would ask, because then that would in a way like raise the priority if I knew, patient who was managed care was there for 4 days and they averaged 10 to 14 days. I probably only had 5 days to get things going. And what we presented was complementary nursing assessments. I did a home assessment for every single patient that I saw. To now, even to today's my business now, we don't take on a new client until we see the home. Like there's no ifs, ands, or buts. Like we're communicating that back to the team. We're communicating that back to home health. We're working with the DME companies. Like if I knew we had, let's say, 5 days versus 30 days, like that's going up the priority board. Not to say like anyone else is being bumped down, but my goal was to help their outcomes and their length of stay goals, because then me and let's say another representative from Spalding, we could go into these other hospitals and say, hey, when you refer Spalding and X company, you're going to get more of like a higher or better outcome report for your team. Makes the hospital happy. They're saving money. The physicians are happy, which ultimately, not to be business development, but like that's going to lead to more admissions. It's going to filter out and in a way kind of like handle the overflow of emergency rooms and free up beds and ultimately provide more beds and opportunities for people who need the actual care. So everything was connected. So what type of admissions were you receiving? Understanding that. But then I would ask her, like, what does that look like for you? Like, how are you handling those discharges when by the time you get an admission, you're discharging them? Or if it's someone with an X, Y, and Z need, why are they in your building for maybe 6 months, right? Like, what does that even look like to, who do you use for home health? Who do you use for your DMA? Who do you use for your hospice? Who are your primary feeders in terms of the hospitals and the physicians? What resources you have out there? Because if I were to get a referral tomorrow and I'm bedside with my nurse, when you meet with families, they pretty much unload everything on you, and it's fine. I want you to. But if they do ask, like, hey, I don't have a POA from a mom. Do you know an elder law attorney? Or, hey, I don't really know this company. Like, what's this about? Or, hey, why are you private pay when my dad's got, Medicare and the best insurance because he was a state employee? It's like, in a way, you have to educate them on a lot of things, but you also have to speak the same language and work within the same playing field as the referral source, but also be part of the team. So my job is to now then build those relationships outside of Spalding on who he works with. So that way, if I ever got a referral, I know the players are. Um, and most importantly, like, how can we help you? Not just with your day to day, but your patients. Are you seeing more falls? Are they more readmissions? Is there a lack of social engagement? Are there certain, like, not to be hospitally, but like social determinants that are a factor right now in the city of Boston? Maybe it's funding resources. Maybe it's VA benefits. Maybe most of the patients have long-term care insurance and they don't have support with someone like me to go in and review them for them and guide them through that process as well. Um, when are your utilization review or care plan meetings? I'm not going to come to your building when you're at a meeting all day. Or maybe I could sponsor one. Maybe I can educate your team. Maybe I can give you some of my data or KPIs on a quarterly or biannual or annually basis. So I had to know every single thing about this building. And you can imagine this is way more than 10 questions. This is like a science. And I didn't say one thing about my company because then I would say, like, well, if you have UR every day, well, I'm like the kid who always asks why in class, although I wasn't the greatest student. So why was I asking why so many times? But I would say, like, well, if you have a care plan meeting every day from, let's say, 9 to 11, like, how do you get your work done? Right. Or if your social worker is doing this and has 3 admissions and 5 discharges the same day, like, how do I fit in? Because my ultimate goal wasn't just to get referrals, but like, how do I get 60 people plus the senior director to one day say, how do we make this gentleman and his colleagues in his company part of our everyday conversation and process? So while I was sending those emails, I still was building the relationships with the community partners that I knew they were referring. So even if Spalding wasn't referring me, maybe that home health company would refer me, where then home health could say, like, hey, give this company a chance. They're really doing a good job. That was a long-term goal. Maybe she would say, wow, this guy sent me 15 emails. Maybe I'll finally answer them. But like, I wanted to create a word of mouth and a presence and a brand in the community while I was establishing that rapport with Spalding. But these questions are so key.
That was Wayne, this was so good. And I'm thinking in my head, like, we have to publish this list of questions that you put together because you probably said words in there and people listening to this are like, wow, I don't even know what some of those words and questions are. But like you said, it's like a science. Like, you had to understand the science of Brienne's world in order to develop that trust, in order to even get that first referral. Brienne, the question I have for you, in home care, we talk a lot about fall prevention, socialization or social determinants of health, and rehospitalizations. Like, home care is approaching the acute space and trying to articulate that that is what home care can do. My question to you is, are those the 3 most important things that you care about? Or from all of those questions and things that Wayne just talked about, are there other things that are higher priority for you that home care needs to be aware of?
Oh, that's a great question. I think those are great points. Absolutely. We've talked a lot about like yes and no and saying yes and saying no. But I think one thing that I would really focus on is if we have to say no for safety, makes sense, but how can we get to a yes? You mentioned social determinants of health, and that is of those 3 really what stands out to me. If you look at different reports from hospital associations of the reasons why patients are stuck, for lack of better words, we use the word stuck, but stuck in hospitals, often it is those social determinants of health. And it's not necessarily medical. The medical team has done what they needed to do, but that patient isn't able to go back home because maybe there isn't a home, maybe the home isn't accessible. So being able to think creatively, think innovatively, think outside of the box. I think my team learned very quickly when I worked with them that I don't often just say no. I ask a lot of questions. I to get to that yes and to understand like what we need in that particular situation. So of those 3 points that you highlighted, Miriam, like literally what stands out most is those patients. Patients, as we are seeing with our family members, as we see in our communities, as we see in our hospitals, there's so many social complexities that come along with that patient. It's not just the stroke that they have. There's so much more. And so being able to highlight and recognize, and I like what Wayne said about the home, because that is so important. And there's often, whether the patient isn't able or doesn't want to share the challenges that they may be facing in their home, there's so much that we learn when we go into someone's home about their safety, which will in turn, one of your other points was readmissions. And so working alongside with home care providers, amazing. Hospitals can't go to the homes like we used to be able to. We have great partners. We have great home accessibility questionnaires. We have great resources and tools, and we use pictures and we use family, all those things, but can't go to the homes. And so being able to have partners that will do that to ensure that it is a safe discharge plan. I think also another piece I want to highlight is just along with the social determinants of health and social issues is just like understanding the emotional, the mental health, the toll that these injuries or illnesses or just aging can place on a person themselves and a family member, and really thinking back to the root of the relationship. Like we're all in this together. Like we're all after the same mission, and the same goal is really to be able to provide that best care and the most safe care for the patient throughout the continuum, regardless of whether we're working in an acute hospital, in a rehab hospital, a SNF, or a home care. That continuum of care, we're all have that same mission. So if we can continue to partner together, we're going to continue to do great things and even better things.
Okay, so I want to great response. And I think it's interesting to hear your perspective on this about of those three, like social determinants of health as the one that you are thinking about and focused on the most. I think home care has talked about that and is thinking about that, but I think we currently are putting a lot of emphasis on like fall prevention and readmissions. But I think that those two actually come together with the social determinants of health. Like you
They
said,
do.
the social complexities of a client and of a family, like we have to address those, and then the fall prevention can be reduced. Then the hospital readmissions will be reduced. Like the social complexity is what we have to focus on. I want to take this in two directions, Brian, with you. I want to talk about like the partners. You said like community partners or like power partners. I want you to think of like your table of power partners that are most important to you, and Wayne like got a seat at that table. Paint the picture though of who else is at that table in your mind. Like Spalding is like the head of the table because everybody wants to work with you. Who are the other partners at that table that are the most important and valuable to you?
In my head, I will always want to be able to name like our top 3 partners for every different area of care. Like, so when case managers are setting up a discharge plan, they're setting up everything from ensuring that the patient has medication to ensure that they have the appropriate durable medical equipment, that their home is accessible or safe, or, if there's installations needed, making sure the patient has a primary care provider. Do they need a higher or lower level of care, assisted living, hospice? So in my network in the field of case management, always want to have 3, because we want to give patients choice, of course. It's important for them to be able to have that autonomy and make that decision on their own, from a variety of those practices. Others that we don't often think about, but that have been really great resources are med flight partners, obviously visiting nurse agencies, um, companies that could provide oxygen. There are times where there are limited resources in the community, whether like it's a shortage of speech therapy or home health aides. So being able to have those different referral partners. But I mean, I could probably write a list of like 25 different providers. But when you think about like that patient really being at the center and all of the people around them and things around them that they need in order for a successful discharge home.
And did
Um,
I understand right that you have kind of three per category?
Yeah, I mean, on my like list, there's could be 20, but I think in my head, I want to know that I have 3 people and agencies that I've worked with that I really trust, that I could call right now and say, "Hey, Wayne, I have a patient who, and then I can make that referral right away. I think 3 is just like my go-to number to ensure that like there's patient choice and that there are always is a provider available.
The reason why I specify is it's good to hear you quantify those numbers because, again, a home care agency approaching someone like Spalding, it's like, okay, Brienne has a list of 20 to 25. How do I make the top 3? Like that is my goal is yes, I need to make the top 20, 25, and that's a challenge in and of itself, but I also need to be in her top 3 and how do I get to her top 3? Like that's why I'm asking because that's
Yeah.
an important
Yeah.
differentiation.
One thing that I think about now that you say that is everyone can have their first case, right? We can always have that first successful referral, that first time that we work together, and that's great. And it's usually like really exciting and there's lots of, celebrations if it goes well. But what about the second and the third and the fourth? And those are equally as important. And I think being able to show follow through and consistency that the second referral was just as good as the first, if not better, but also being able to share client testimonials or outcomes. Case managers love outcomes. We want to know, especially for discharging a patient, and they've worked so hard in PT and they've gotten to this point of, ambulating 200 feet with just a walker. We want to know that when they get home, that they're continuing to progress to that level. So client testimonials and outcomes are always huge. The follow up of not saying like, oh, hey, I have, are you interested in referring another patient? But hey, let me talk to you about, Mr. Smith and what we did with Mr. Smith, and look what Mr. Smith had to say. Um, so those always really stand out to me as hearing directly from that patient and family, which is huge. And families want to hear that too. They want to know, like, they're overwhelmed. How can I pick a home care provider? You just gave me a list of all these agencies that really mean nothing to me. Some people, truthfully, will start with, oh, what's their rate? What's the most affordable? In the grand scheme of things, we all know I'm not even a home care operator, but we all know that it's all relatively similar. So really focusing on the person that you really built that relationship with, that person that you connected with, and being able to have those positive client testimonials and outcomes.
Mhm.
That was great.
And Wayne, that probably became your cadence for going back to Brienne is you get a referral, you have success, you have
Yeah.
those outcomes, you go back to her and report on those things, and then naturally more referrals come. Talk a little bit about Wayne about
Yeah.
like the maintenance of the relationship. Like you get those first few referrals,
Yeah.
and then what does just like the evolution of that relationship look like?
Yeah. So Brian, I feel like I was just in the meeting for the first time. That was great. I'm ready to end this podcast and go business development. No, I'm just kidding. Honestly, I actually sat here and just like reflected back on my work because what was discussed is everything I did for children. Putting patient-centered focus, like a wraparound approach, is what I've learned through care management organizations. And that was really refreshing to hear. Thankfully, I did go in with a lot of that in my tool belt with my previous job. I mean, I worked for a very successful company in New Jersey, right? Like I knew all this, but I learned it all from other hospitals. Like I tell now my business development team and colleagues and just people all over, like, you have to talk about every single thing first before you start talking about a certified home health aide. That's what you're an expert in. Like, talk about transportation, PCP. Maybe they didn't meet therapy goals. Are they going home with new medication, new DME equipment? Like, check off every single box first and then be like, okay, and this is how my certified home health aide is going to help. Because guess what? With all that checked off, you're actually helping out your certified home health aide at the same time. So to go with that said, like, a little bit of the secret sauce, but it's not rocket science. Like in 2017, I went to every social worker and was like, how do I become your top 3? Like, I know I'm at the bottom. Like, what do I do? I mean, I was showing up to places on the 4th of July, like skeleton crew, just to be like, here I am, like, happy 4th of July. But like, every single person to this day. And it's like, if you've listened, and not to plug it in, but like my previous podcast, you can have a trillion relationships. That's great. But this is like everything that Brianne literally said is like back to what I said in our original podcast. Like, you have to maintain this and you have to like really work hard for this. Like, it's really hard to like build systems, and then it's even harder to follow them and then have a team to follow them. Because if there's one slip up in the system, the quality of the care dilutes. Things are just not going the way it should be. So with that said, like, listen, first referral, right? It's great, it's a celebration. My first referral was not easy, but to me, it was easy because of everything that we built on the back end operationally, plus my experience, but plus the expectations that we knew from Spalding. So it's communicating, right? So I'm very big on quality assurance. What are we doing within the first 24 hours? What are we doing with the first week? What are we doing within the first 2 weeks to the 30 days? I'm not a guy who's going to be like, hey, by law, every 60 days we have to do a reassessment. Like, no, this is a high risk client. What are we doing from now to 60 days? What's the communication back to home health, to DME, to the physician, to the ACO group, to the hospital? The hospital might not even know me. Guess what? You're getting an update regardless. So, but like she said, let's celebrate the win, right? And then on top of that, what are the outcomes? What are the goals? Maybe this person was in the hospital 6 times in 30 days. Now they surpassed 30 days, right? So now to this day, like, I build a beautiful certificate for every patient that graduates my readmission program, and it gets funneled to every single person on the team, even a crossing guard if they're involved with the patient's care. So, one, the data always tells you a story. Follow it, be passionate about it, let it sometimes make decisions for you, communicate back to the partners, and continue just what you do really well, your assessments, your process, your communication, your follow-up, track your data. If there's a challenge, go back to the team who referred you and ask if they have a resource. Be transparent, because all this at the end of the day too, as an operator, the more you do all this on the front end and throughout the process, guess what you're doing? You're attracting better caregivers, you're retaining them, you're setting clear expectations for them to accept the position, which is going to keep your longevity in place and lower your turnover. You're going to pay them the right rate based on their skills and their strengths. And then that client's going to have an amazing experience with your company, as will your caregiver. Now you're increasing your client length of stay. This is all being funneled back to Spalding. And now that one referral turned to two, and then it turned into four, and then it turned into eight. But during the eight, there was one or two saying, you know what, at this point, I don't think this is home care appropriate. So now what do we do? Because I knew if I said yes to everything, the quality of care in my process would be diluted. Like, we stayed in our lane. We never turned our cheek the other way. It was like, hey, have you ever thought, if home's not the right answer, what the next step would be? Like, that's what we're saying to families. And maybe Brianne's team's like, hey, we've been trying to encourage the family to consider another option. Or, hey, if you go home, maybe you don't have the right funding or the right home environment. Like, what do we do now? Like, we're not just going to take you home. Like, it's not just client caregiver revenue, it's beyond that. So I would say everything that she said is what we did, plus more. And then I would come in with testimonials, certificates, and data and say, hey, we got 8 referrals in the first 6 months. This is our readmission rate for those 6 specific patients. Here are the outcomes. Here are the success stories. Here are even our failures. Like, and the data spoke for itself. The testimonials spoke for itself. But like Brian said, if there's 20 companies, that team can literally say, like, hey, they have, let's say, a 2% readmission rate. All their clients are staying home. They have a great experience. We have great feedback from the families. Their caregivers are coming in and training with their teams. Like, they're communicating back to us. Like, they don't steer families in any direction. And I'm talking just general. But for me, if I was a family and I heard all this, I would say, like, wow, I would want my mom to have a great experience like the rest of those families did. And for us and for me, that's what it's about. Positive experiences for every family, every person who calls his office, and every caregiver that walks through the door. Like, you might need home care, you call us, like, we're going to figure it out. And I think with that model, it's like everything, the business part just falls into place.
That was fantastic, Wayne. Brianne, I want to ask you two quick follow-up questions because Wayne is talking about like all of the data and information and the outcomes. I want to ask you, is there such thing as over communication? Do you want to know every single thing about every single referral all the time? Is there such thing as over communication? And then how do you want to receive those updates, receive that information? Is it an email in real time when things are happening? Is it a weekly email? Is it an in-person every month? What's your preferred method of receiving that information?
That's a great question. I mean, typically, I would say that there's usually no such thing as over communication. However, I, as the case management director, truthfully can't take all the information in as far as what's happening. I think that ultimately I want to know that that patient is safe is being well cared for and that things are going well. And certainly if there's hiccups or if there's issues that come up along the way, how can myself or my team help support to solve those issues? But I think the biggest thing is being able to trust when you're discharging, 50 plus patients a week. And, you really need to be able to discharge them and know that they're in good hands. And then as far as communication goes, I've had different organizations do it different ways. Some want to have monthly meetings. That's too much. Some want to have quarterly meetings. I welcome emails with updates. I welcome, you think the more volume that you do, there is a possibility that it would make sense to do, quarterly meetings to really talk about the volume and talk about outcomes. But ultimately, I think email is a really great form of communication. It allows us to then disseminate the information to the doctor that cared for the patient, to the PT that cared for the patient, and be able to say like, "Hey, here's a quick blurb on how Mr. Smith is doing at home, and they're doing really well." And grateful for that partnership.
Okay. Yeah, that's good to hear because like you alluded to earlier, like you're so busy and you can't know everything about everyone all the
Right.
time. And so that's why I was curious, like,
Yeah.
what's your preferred way? Because when we talk about volume, like this is a lot of clients and a lot of families, like you personally can't facilitate and be in the know on everything.
Yeah, absolutely. But typically, my answer would always be there is no such thing as over communication, But I think just knowing, like, oh, that this patient now is the details make it harder to follow. But just knowing that we can trust is the biggest thing.
Yeah. Okay, wow. So many good like moments and information inside of this session. Just one last question for each of you. Wayne, you've talked about a lot of the good things, the things that you've done right, the things that you've learned just over time, accumulating all of your experience. I want you to just look back and think of maybe some of the mistakes that you've made so that everyone listening to this can learn from some of the things that you did wrong. So, in just a couple of minutes, one or two mistakes that you made along the way that can be pitfalls for other people to avoid in your experience?
So I've made a lot, one or two. I mean, it really goes into like a quick, like just, I have like a 6 bullet like formula in my head. I was impatient. And a lot of times you have to be patient. Don't rush your processes. I've done that so many times, and then you lose sight and you create gray areas within your process, and that leads to service failures. Um, I think also like composure and humility. Like there's were times I wasn't composed because this business is tough as an owner, as an operator, as a business development person. Like I'm just telling the listeners now, like, yeah, I own a business. I'm literally on the streets pounding the pavement still every day. Like that's the only way you're gonna learn. So like I just stay composed. Like there were times where I felt isolated and alone and didn't go to the last meeting or went home earlier than I should have. Like I think just remain calm, don't like react with emotion and in any scenario, like literally. Take a second to think, call somebody, go visit your team just to like remind yourself like the business you're in. I did a lot. I went and saw my operationals team, not just to thank them, but to like bring myself down to earth. Um, Stay consistent with your goals. Don't try to tweak them up every month or every quarter. If you have a yearly goal, stick to it. Because if you start flip flopping, it's just going to be chaos. So stick to your goals. Continue like have weekly meetings. Just stick to the course. Like I think there were times like I just maybe didn't speak up. I wasn't composed. I wasn't patient. Um, I lost, my motivation, and I also didn't accept humility. Like honestly, like if you can factor in education, consistency, humility, composure, and patience in any role in this space, you're going to be completely fine. And now at the point, like in my next year of my life, like or career, like you got to like look for people that are better than you in certain aspects of your job. You got to lean on people that are more experts in certain areas, and you got to learn from it, and you got to work before and after hours. But I always say like there were times where I just felt like isolated and I didn't really like focus. um and till this day, I mean, what was our call an hour ago? I probably made two mistakes. Honestly I probably did, but I think it's just grounding. So I have this on a whiteboard in my office. um and it's a great model just to go by, personally and professionally. And if you stay that course, you're going to be really, really successful. And so that equals growth. So it's not just money, it's growth. So whatever your role is, you're going to see growth if you stick to that. So, and it's okay to make mistakes. It is. Just learn from them.
I love it. Thanks for sharing, Wayne. You said it earlier. You really do walk the walk. You and I have a phone call like every couple of months. And every time you call me, the first part of the conversation is you telling me what you're doing in that moment. You're driving to a client, you're driving to a hospital, you're talking to a referral partner. Like Brienne shared it earlier, like she could sense your passion for this business. And every time I talk to you, like I feel that passion as well because you're doing it. Like right now, we're recording this podcast, but you're going to walk out the door in 20 minutes after this and you're going to be pounding the pavement, knocking on someone's door, walking into a hospital. Like you're so in it day in and day out, and that energy and that passion radiates. So I love the formula that you put together because you have years of experience doing this, but you're still like so in it, which I love. Brienne, last question for you. This is an audience of home care leaders listening to this podcast, and you come again from this point of view, and you've shared so many great insights today. I just want to give you one more opportunity. If you had a room full of home care owners in front of you right now, which you do, what would you say to them? What's like a piece of advice that you want to instill in them of building relationships with leaders like yourself? Like what do you want to tell them about how it's possible, about what they should do, or what they should leave this conversation and go and do in their business?
Thank you. And thank you for the opportunity. Passion, persistence, remembering that the people that you're working with, most are social workers, nurses, that are case managers, and they're in this field because they want to help and they want to make a difference. They may not remember your sales pitch. They may not remember your rates or how many hours you can service a patient, but they will remember how you cared for their patients. And I think that that really is just such a takeaway, is like they will remember that, and it will be a natural relationship, a natural evolvement, and they will think of you. Um, Show an investment in who they are and what's important to them and their organization and their hospital, understanding what their pain points are, speaking their language and listening is key. And then back to the data and the outcomes. Show up with data and patient stories, a picture with a patient of what they're doing in the community. Like amazing. Goes a long way. So data, not coffee, and just really continue to forge that relationship and show how genuine you are in the work that you're doing.
So
So good.
good. This
Ready to
has
run through a
been
wall.
a fantastic conversation. Brienne, Wayne, thank you so much for joining me in the lab. Everyone listening to this, connect with these guys. They're on LinkedIn, they're out, on the web, connect with them. And my advice is find the Briennes in your market. I think we all want to spend more time with Brienne because we've learned so much from her, but find the Briennes out in your market. Find these Spaldings, find these partners, and get your foot in the door and build these relationships and learn from Wayne. It's not easy, but break down the science of what it takes to get into these offices and put in the work, and you will reap the rewards. So fantastic conversation. Thank you both for joining me in the
Thank you.
lab, and we'll look forward to more again soon.
Awesome.
Thanks so
Thank you.
much.